All right, hi everyone, and welcome to Webinar Wednesday. I'm your host, Jessica King, and I just wanted to thank you for joining us today. As you probably already know, October is Breast Cancer Awareness Month, and today we'll have OBGYN physician Dr. Megan Pallister go over some ways to help reduce your risk of breast cancer. And here's a little more info on today's speaker. Dr. Pallister's clinical interests include abnormal uterine bleeding, routine gynecologic care, minimally invasive surgery, hysteroscopy. Thank you. Pregnancy care, office procedures, and
colposcopy.
Okay, there we go. She joined Kelsey-Seybold in July of 2016, which means that you just celebrated your 1-year anniversary with Kelsey, so congrats on that.
Thank you.
And she also practices at 2 Kelsey-Seybold locations, the Tanglewood Clinic and the Women's Center. Don't forget that we'll be taking any questions you have at the end of the webinar. If a question happens to pop up, just type it into your question box and we will do our best to address it after Dr. Pallister's presentation. And now I'll hand it over to you.
All right, so just a little bit anatomy about the breast. It's, of course, an important component of the reproductive system, and one of its main purposes is to make milk. You probably can argue its main purpose. It's made of fibroglandular tissue, which has milk lobules, ducts, and supportive tissue, and of course there's a lot of fat tissue as well. So in the U.S., breast cancer is the second most common cancer and cause of cancer death in females. The number 1 diagnosed is skin, and the number 1 death is lung cancer. In 2017, so this year, 255,000 new cases of invasive breast cancer will be diagnosed, and 40,000 women will die. But there has been about almost a 50% decrease in death rate since 1989, so that's pretty amazing. In the U.S., 1 in 8 women, so that's about 12% of women, will develop invasive breast cancer in their lifetime. So, of course, I don't work with a lot of men as my patients, but we have to be aware that men can also get breast cancer, and that's about 1% of all breast cancer cases. So especially when you're thinking about your history, you should always know about your family history, whether your father or anyone in your family, males in your family, have had breast cancer, because it comes into play. Of course, when men are thinking about symptoms of breast cancer, you want to think about misshapen breast, if the nipples or the breasts don't match, and any nipple discharge, especially bloody discharge. And usually breast cancer in men, but not always, will show up as a lump in or around the nipple. So, of course, there are some obvious risk factors and some not so obvious risk factors of breast cancer. Of course, being female, like we just discussed, as we get older, we get a higher risk of getting breast cancer. And then, interestingly, beginning your menstrual periods at an early age and going through menopause at a later age. So I like to think about this as the more periods you have, are more likely to have an increased risk of breast cancer. And then, of course, race and ethnicity comes into play. As like all cancers, and of course personal history of breast cancer or precancerous lesions, increased density and thickening of breast tissue, and that's because mammograms, that makes it difficult to see things like that on mammograms. See breast cancer, abnormal breast imaging on a mammogram. And then a family history of breast or ovarian cancer such as BRCA or BRCA. So there are 7 ways to reduce your risk. Of course, like I discussed a little earlier, know your family history, know what age your family was diagnosed, know if there are genetic mutations or not. Of course, we don't always know that, but that would be ideal if we could know that. Of course, we want to minimize our radiation exposure. That's not an issue for most people, but it's something to know. We want to limit our hormone exposure if we can. That's a good conversation to have with your OB-GYN when it comes time that you may or may not need hormones. Pregnancy and breastfeeding can actually reduce your risk. So breastfeeding for at least a year can do a lot of good things for your risk, decreasing your risk for breast cancer. Of course, no smoking, and then reducing your alcohol intake and avoiding obesity. Obesity can increase your risk of breast cancer. And of course, get screened. Come to your OB-GYN every year and get screened. So a little bit about knowing your family history. About up to 10% of breast cancer is hereditary due to genetic mutations. Commonly, these are the BRCA mutations, which I'm sure most of you have heard about. There's BRCA1 and BRCA2, or BRCA1 and BRCA2. It's not only breast cancer that these genes increase your risk of, so that's important to note. But if you have BRCA1, your lifetime risk goes up 55 to 65%, and if you have BRCA2, your increase is 45%. And like I said before, both paternal and maternal history of breast cancer is important. And so talking about radiation exposure, so women, not pertaining to everyone, but women who have had radiation therapy to the chest area, like lymphoma, in the past have increased odds of breast cancer in the future. And it's highest if the radiation was given during adolescence, when, of course, the breasts were still developing. This is a website where you can, cancer.org, you can find more information about this. So hormone exposure. So the WHI, the Women's Health Initiative, found that long-term use of combined estrogen plus progestin slightly increases risk of breast cancer in women. So this is something that you want to talk about in detail with your OB-GYN. It's really can be confusing for most people. So come talk to us and see if you're, at increased risk of breast cancer, or if hormone therapy is right for you. Birth control pills have a slight increased risk of breast cancer, but after using them for 10 years, the risk normalizes, and it can actually decrease risk of benign breast disease, which comes into play as well. So a good conversation to have with your OB-GYN for more information. So pregnancy and breastfeeding. So really interesting that breastfeeding has been linked to decreased incidence of breast cancer. And so, like I said before, the more periods you have, the more likely risk you are for developing breast cancer. So when women have had no children, that means they've, those 9 months of having no periods, that comes into play, right? So if they've had their first child also after the age 30, they have a slightly higher breast cancer risk. And so for every year of breastfeeding, there's a 4.3% reduction in the relative risk of breast cancer, which is really interesting. So don't smoke. We all know that. You shouldn't smoke for many reasons, but evidence, of course, suggests linking breast cancer and smoking, as well as other cancers. And actually, it's more important in premenopausal women, but of course, postmenopausal women as well. So research has found that smoking early and before the first birth was associated with increased breast cancer. So that kind of suggests that smoking may have a role in breast cancer initiation. Alcohol intake. So the more alcohol you drink, the greater your risk is of developing breast cancer. There are so many studies on this. It's hard to say exactly how many drinks and what kind of drinks also, would increase your risk of alcohol, but 2 to 5 drinks a day have a 1.5 times the chance of increasing the risk of breast cancer compared to women who don't drink at all. The reason is because alcohol can increase estrogen and other hormones in hormone receptor positive breast cancer, and it can also increase cancer risk by damaging DNA and cells. So then it can increase risk of other types of cancer as well. So obesity. So a body mass index of greater than 30 has been associated with a higher risk of breast cancer in postmenopausal women. In a nurse's health study, women who gained 10 kilograms or more since menopause, so that's around a little over 20 pounds, had a higher risk of breast cancer compared to women who maintain their weight. And this is just a little picture of BMI. So healthy would be about 18.5 to 25. You can ask, we measure BMI every time you come see us, so you can always ask us what your BMI is. If there's also calculators online, but if you're interested, we can always tell you. And obesity is related to higher levels of estrogen and insulin. Our fat cells make extra estrogen, and that can be deleterious for a number of reasons, but increasing your risk of breast cancer especially. So avoiding obesity, exercise, get moving, eating right. We have dietitians at Kelsey, so those are a great resource. Starting now, not tomorrow. Everyone's diet starts tomorrow, and make it a lifestyle. It's hard to do, easier said than done, but for your overall health, it's very important. And again, the Women's Health Initiative, or you may hear it as the WHI, finds that women who walk briskly for 1.25 to 2.5 hours a week have 18% less risk of breast cancer than women who are inactive. And that's a pretty big decrease. And this is because exercise lowers estrogen levels, and estrogen stimulates cell overgrowth and breast cancer, like I talked about before. So estrogen, as you're hearing a lot, is a huge play in breast cancer. So the right foods, what are they? Well, lower fat intake, of course. Carbohydrates are also important. Sugars. Know what's in your food, I think, is the most important. I think, a low fat diet is not the key to everything, but it's important. And so know what's in your food and know what you should take in every day. Red meat intake, we know that has a huge effect on heart disease, but it also has effect on breast cancer. I mean, it's all kind of comes into play with, preventing obesity. Carotenoids are found in fruits and vegetables. These are good for you. And then women who consume these have a lower risk of developing estrogen receptor negative breast cancer. And so when we talk about estrogen receptor positive and negative breast cancer, the thing about estrogen receptor negative breast cancer is that these are often more aggressive than the other, because and we also don't have as many medications to treat these types of breast cancer, which is a problem. Among Asian women, research has shown that a higher intake of isoflavonoid, I don't know how to say that actually, isoflavones, I don't think I've ever said that out loud, but they're found in soy. And so if they would take over 20 milligrams a day, and it's associated with 29% reduction in breast cancer risk. So we should all eat like that. So getting screened. So self-breast exam. So as an OB-GYN, I think a lot of us will say, you really have to talk to your OB-GYN about this self-breast exam, because you really have to know how to do it. So the most important thing is doing it at the same time every month, and don't do it when you're on your period, okay? Or right before your period, because you're going to have, especially young women are going to have, little lumps and bumps that they find that these are going to go away. So, if you don't want to do a self-breast exam, that's okay. If you're coming in every year to see your OB-GYN and getting an exam and getting a mammogram, if that's necessary for your age group, then you don't need to do it. A lot of us will say you don't need to do a self-breast exam. But if you want to do a self-breast exam, then, you need to do it at the same time every month, and, make a note of what you feel and see if it's there the next month, and come in if you're worried, of course. Okay. But the reason why I say you don't need to do them is because research has shown that self-breast exams increase anxiety, which then increase, coming to the doctor and getting, testing and even biopsies that aren't necessary. And multiple biopsies can increase your risk of cancer. So this is another conversation you really want to have with your OB-GYN or your PCP, that whoever is doing your exams and ordering your imaging. So very important to know. So the clinical breast exam is done by, a health professional like myself. And this is why you come in every year. You want to talk about your family history. Someone may have developed breast cancer in the past year. Your mom, your sister, aunt, and you want to know if that increases your risk. And so that is all important in calculating, your personal risk of developing breast cancer. And then you want to talk about imaging if you need it that year. Every task force is going to say different. The Cancer Society, ACOG, which is the American College of Obstetrics and Gynecology, we're all, kind of differ on this subject, when to start and when to stop. If you ask most OB-GYNs, we're going to say start at 40, do it yearly until we're 75, or until you have that conversation with the patient, okay? And this is if they're normal, of course. And there's a bunch of different types of mammograms, or, there's some types of imaging, I would say. You may just need a regular screening mammogram, depending on your previous mammogram, you may need a diagnostic mammogram. It's really important to come in and be seen to have this conversation. Ultrasounds are recommended if there's something abnormal or if we're young. And MRIs and PET scans are also used in certain cases. And then we also have 3D mammograms at Kelsey, which are shown to be beneficial in certain groups. The 5-year survival rate, this is really amazing, and this is why, so much research has been thrown into breast cancer, and I think it's done a lot of good, because the 5-year survival rate for breast cancer, if it's found early and confined to the breast, which it most of the time is, thankfully, is 99%, which I just think is pretty amazing. So most important thing in this whole PowerPoint is get screened and talk to us with any questions you have. So I mentioned this a little earlier, but breast density. So some people are just prone to have more dense breasts, and you've probably been told that in your life before if you've had an exam. Having dense breasts makes your cancer risk, it increases it 4 to 5 times higher, which is crazy, but it's because the imaging, you can't really see or detect, signs of cancer that well. So the clinical breast exam comes into play a lot in those cases, but it's something to know, of course. Breast composition can, of course, vary. Every woman is different: size, shape, symmetry, composition. There's some x-rays, some mammogram x-rays here that you can see how different breasts can look, and all these can be benign. So it's a big job for radiologists to read these.
All right, so we have some time for some questions, and I just wanted to start us off. So you mentioned doing a self-breast exam, and you should do them once a month if you're doing them correctly?
Yes.
Correct? Okay. And you can go over how to do a proper self-breast exam with your patients when they come in. Right?
Okay. Yeah, no, definitely. Yeah. There are multiple ways to do a breast exam, and so different providers may do your breast exam differently, but you can go circumferentially from the outside in to the nipple. You can go kind of counterclockwise or clockwise. You can go out in, I guess I would call it kind of sun rays and do it that way. And then it's important to ask your provider how to do it, because some people don't know they have breast tissue in their axilla, in their armpit. And so we also feel for lymph nodes and for breast tissue in your armpits, because breast cancer can be found in there either. That's the tail of the breast where that is found. So it's important to know that, because if you're just doing, self-breast exams and didn't know that, you could miss something.
Mm-hmm. All right. So if somebody has a common family history of breast cancer, should they get their mammogram or get tested early? And if so, do you recommend like a certain age to get tested by?
So that's a good question. So I always ask family history and what age the family was diagnosed. And that's very important, because usually genetic predispositions are when family members have cancer at a younger age. So if I indeed think that you need to be tested for a genetic mutation, we have great oncology, hematology doctors who I'll send you to for referral to see if you meet criteria to be tested for the BRCA gene. And if so, they will test you, and then we can decide if you need imaging or not.
Okay.
All right, so we have a question here. Let me read them. What if you are postmenopause and cannot calculate around a period? What would you recommend?
For your self-breast exam, you said don't.
Self-breast exam.
Yes.
I would just do it once a month. At that point, your period, doesn't come into play, because the period is the reason why I'm saying don't do it on your period is because right around the time of your period, breasts tend to kind of get dense and tender, and there can be lumps found. So if you're postmenopausal, most likely you're not having those hormone surges. So it's not necessary. If you just do it once a month at the same time to kind of give yourself give your breast 30 days to kind of see if something's going to change or not. And then it come in if you have an abnormality that you feel. Okay, and then this is the question I knew I'd get. Do you recommend mammograms be done every year or every 2 years? So I am always going to do until every single society agrees that it's every 2 years. The ACOG, our Society of OBGYNs, still say that it's, we have the conversation with the patient that we start at 40 years, and if they want to go every 2 years, that's reasonable. Okay. But I'm going to recommend it yearly. We know that it decreased the risk of breast cancer. And so I'm going to recommend it yearly. But again, a lot of people will say 2 years. The American Cancer Society has come out and said they can do it 2 years. There's so many societies that say different things. Another society says start at 45 and do it yearly until 55 and then do it every 2 years. But as an OB-GYN, most women are going to, most OB-GYNs are going to say every year. Okay, and then if you started menstruating at an early age, should you be concerned and should you see your doctor more often? So we have a breast cancer risk model in our system that we use for women who are, postmenopausal and to gauge their risk of breast cancer. And so when I say that you have a higher risk because you had your periods at an early age, it's not that specific thing does not put you at increased risk. It's a lot of things. It's every single thing like smoking and alcohol use, everything adds on a little bit, but it's not one thing is like you're going to get breast cancer, But of course, like I said, 1 in 8 women will, but that's over their lifetime. So it's hard to say that yes, you started menstruating early or late, like you have an increased risk or you don't have an increased risk. You do not need to see your doctor more often. Yearly is enough. If you have multiple risk factors and your doctor notes that, then, there may be evidence that you should be screened for genetic reasons or other things. But, you don't need to see your doctor more than once a year for a mammogram unless it was abnormal in the past. I have an IUD and I rarely get periods. Does this increase my risk? No. IUDs have not been shown to increase breast cancer risk at all. So do not worry.
So we know that not all lumps are cancerous. Obviously, we've gone over that. Can you go over what some of the lumps could be that are not cancerous that you're feeling?
Yeah. So most commonly, lumps are benign, and they're most commonly called fibroadenomas, which are, dense little fibrous tissues, kind of like we have in our uterus, some women, but not the same. They're just kind of little muscle, kind of fibrous tumors that are benign, but they do give people a lot of anxiety and a lot of, stress when they feel them. So some things that are signs of benign masses or lumps are if they're mobile. So that means if they move around a lot and they're not fixed to your tissue or even the bone, that's a good sign if they're mobile. If they're kind of well circular and kind of round and kind of feel fat globule, I don't know if that's a word. That's a good sign as well. But these, again, when you ask your doctor about your self-breast exam, or if you don't want to do them at all, we can talk to you about what are good signs and, to look out for. Okay, another question. Would it be possible to get breast cancer before ever having a period, young preteens? I have seen very young women have breast cancer. I don't think I've ever seen preteen. I can't say that's not possible. But that's a good question, and I don't know the answer to that. I'm sorry.
Can I go back to,
Yeah.
You mentioned the 3D mammography.
Uh-huh.
Is that at every Kelsey location, or is it it's here at Tanglewood though, right? So
I believe it's at main campus.
Main campus.
I don't believe we have it here at
Oh,
Tanglewood.
well, great. So you can go to main campus.
Main campus,
if you'd
definitely.
like to try that one out. Just wanted to let that out
Yes.
there. And I think that's actually all the questions that we have time for. So I'm going to conclude the webinar. And I want to thank you all so much for joining us this month. And we hope that some of these tips will help you in the future or help you right now. Again, if you have any questions, you should visit your OB with any questions relating to this topic. Be sure to join us next month for our webinar on November 4th called Diabetes Management, featuring family medicine physician Dr. Marjorie Broussard. You can tune in and learn the best ways to manage your diabetes and learn how you can help the person in your life that you know with diabetes. And just a quick note on, I know October is Breast Cancer Awareness Month and Komen is usually this month. I just wanted to let everyone know that if you're interested in doing the Komen walk, it has been postponed to January 27th this year because of Harvey. So if you're interested in looking into that, We have a Team Kelsey that you can sign up for if you want to join Team Kelsey and walk with us. It will be going on in January, so I mean that's cooler weather, so that's a positive. And don't forget to follow us on social media and join in on the conversation. Thanks again for tuning in, and we'll talk to y'all next month.